Welcome to Dr. Balga's podcast for the Curious Doc. Today is July 5th, 2026. This video is on a New England Journal of Medicine article, a brief report titled Kidney Transplantation in Two Highly Sensitized Candidates After CAR-T Cell Therapy, published 2 days ago, June 3rd, 2026. Highly sensitized kidney transplant candidates cPRA greater than 99.9% have limited access to compatible organs. This is a phase 1 multi-center study that evaluated CD19 targeted plus BCMA-targeted CAR-T cell therapy to eliminate memory B cells and plasma cells. This is a safety run in cohort with two individuals. One was a 54-year-old black man and another one was a 47-year-old black man. Both had end-stage kidney disease, prior graft loss from antibody-mediated rejection, and cPRA 99.998% and 99.995%. Lymphodepletion was done with cyclophosphamide for 3 days. Dual CAR-T dose was 5 to the power of 10 to the power of 7 CAR cells each product. 5 plasmapheresis sessions plus low-dose IVIG was beginning a month later. Follow-up 18 months after CAR-T in patients 1, 11 months in patient 2. What did they find? There was no cytokine release syndrome or immune effector cell-associated neurotoxicity syndrome. The main severe toxicity, transient neutropenia and leukopenia. Patient 1, the cPRA changed from 99.746 to 99.516%, transplanted date 229, no donor-specific antibody rebound at 12 months. In patient 2, cPRA was 99.995 and was 99.567%, transplant day 93. No donor-specific antibody rebound at 7 months, deep but transient B-cell aplasia, marked reduction in anti-HLA antibodies, bone marrow plasma cell depletion. Limitations of the study: only 2 patients, non-randomized safety cohort. Cannot determine relative contribution of CD19 versus BCMA CAR-T cells. Post-transplant immunosuppression may have contributed to outcomes. Key takeaway: dual CAR-T therapy enabled successful transplantation in 2 extremely sensitized candidates. Durable reduction in anti-HLA antibodies occurred without major CAR-T toxicities. It represents a potentially transformative desensitization strategy. Key takeaways: targeting both memory B cell CD19 and plasma cell BCMA attacks the cellular source of alloantibodies. Anti-HLA antibody reduction occurred before plasmapheresis, suggesting a true biologic CAR-T effect. B cell repertoire reconstituted predominantly with naive translational B cells, suggesting immune resetting. Protective antibodies were largely preserved despite plasma cell depletion. No DSA, no donor-specific antibody rebound observed after transplantation in either patient. Low-dose CAR-T strategy may reduce risk of classic CAR-T toxicities seen in oncology. Potential paradigm shift from antibody removal to antibody source elimination. Larger studies are needed to define durability, safety, and optimal CAR constructs. This is an infographic on this NEJM brief report. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.